Hi, so today we're going to be talking about transcatheter aortic valve replacement. So this is your heart, and right here is the aorta. And within the aorta, right before the aorta starts ascending, there's an aortic valve, and that's what we're going to be talking about. So, what is the aortic valve? The aortic valve is a structure within the heart that allows for the regulation of oxygenated blood flow from your heart to the rest of your body. Now, when there is a dysfunction in the aorta valve, it can interfere with the blood flow from your heart to the rest of your body. Therefore, your heart will start working harder to allow for the blood flow to get to the rest of your body. There are several aortic valvular diseases that could occur in your body. Sometimes patients are asymptomatic, but over time, over a few years, they could start developing symptoms. Some symptoms that are included in this are shortness of breath, chest pain, fatigue, irregular heartbeats called arrhythmias, heart failure, and also sudden cardiac death. There are a number of interventions that will allow to repair the aortic valve, and today we're going to be talking about the transcatheter aortic valve replacement. This is a procedure that's minimally invasive, and it is basically a replacement of the valve when the valve actually fails to open properly, if it's really narrowed, which is aortic stenosis, or it replaces the valve that causes the blood flow to move backwards through the aortic valve into the left ventricle, which is actually right here. That would be considered aortic regurgitation. This procedure is utilized for patients who are unable to undergo surgery or have a high risk of surgical complications but are suffering severe signs of aortic valve stenosis. It involves replacing the damaged aortic valve with a biological tissued valve, either made from cow or pig. Basically, the procedure starts as a catheter being inserted into an access point such as the femoral vein and is guided into the aortic valve. Then a balloon is expanded, which will replace the diseased valve. Now we'll have my colleague go ahead and discuss the indications and contraindications of this procedure.
Hi, my name is Taylor. I'm a PA student. So with the TAVR, there are some contraindications. So if the patient's life expectancy is less than 1 year, if they have a comorbidity that is showing that there's not going to be an improvement of quality of life, if they have an inadequate annulus size, less than 18 millimeters or greater than 29 millimeters, if they have active endocarditis, symmetric valve calcification, short distance between their annulus and their coronary ostium, plaques with mobile thrombi in the ascending aorta are absolute contraindications. Some relative contraindications include inadequate vascular access for transfemoral or subclavian approach, hemodynamic instability, and severe left ventricular dysfunction. There are some complications known with the TAVR. So there is risk of arterial injury upon ascending the valve and bleeding, improper placement of the new valve, the valve moving out of place or leaking. Thrombosis of the prosthetic valve can lead to stroke or myocardial infarction, heart arrhythmias, kidney disease, infection, and valve hemodynamic deterioration. This is when there's a lack of anticoagulation therapy and a valve-in-valve procedure. There's a greater body mass index, and the use of a 23 millimeter transcatheter valve were associated with higher rates of VHD post-TAVR. Thank you.